Good afternoon. This is Dustin Jackson. I will be doing my comprehensive history physical exam and video assignment for Nursing 601 with Professor Sotelo. I will be interviewing Miss V today for our comprehensive assessment, history of present illness, and head-to-toe assessment and review of systems. Ms. B, please come have a seat. Okay, what brings you in today? Why are you seeking care today?
I've had a persistent sore throat, a little bit of a cough and runny nose.
Okay. How long has that been going on for? When did it start?
Approximately a week.
About a week ago? Okay. And how would you describe like the characteristics or the symptoms of what's going on? Do you feel like there's fluid running down your throat? Are you visually seeing fluid coming out of your nose? Are you anything like that? I don't want to lead you, but please.
Yeah, I have obviously mucus buildup at nasal cavity. As far as my throat, I don't really feel any fluid, but soreness when I swallow.
Okay. And it's been sore like that the entire time that you've had these symptoms?
Correct.
Okay. And you said 3 days?
About a week.
About a week. Okay. So the location, do you have any pressure, any sinus pressure up here, anything here?
I get it right here.
Okay. Okay. Does anything alleviate that?
Not so much. I try taking allergy medicine, but I don't really like the effects it has.
Okay. All right. What kind of impact does this have on you? Are you able to work?
I am able to continue working as long as my voice stays intact.
And what do you do for work, if you don't mind me asking?
I work at a restaurant.
Okay, so you're on your feet a lot.
Correct.
Do your symptoms get better when you stand up, sit down? Do you ever get lightheaded, dizzy, anything like that?
No, nothing like that. I do feel better moving around though.
Okay. So you've been working through this. You've not taken any days off.
No, I have not.
Okay. All right. And are the signs and symptoms, are they pretty consistent throughout the day?
Severe in the morning.
Severe in the morning?
Quite intense in the morning.
Okay. So worse in the morning. When you wake up in the morning, is that when it's the worst? Then when you get moving, it
Correct.
Kind of alleviates
yes.
a little bit.
A lot of congestion in the morning,
okay.
And sore throat is very harsh in the morning.
Okay. And all I'm doing is taking some notes on. I use an acronym when I go through this assessment, and I just use client outcomes, and it's character, location, impact, expectation, any neglect or abuse that I might visually see, timing, other symptoms, understanding or your beliefs and how they kind of affect what's going on with you, treatment, complementary alternative medicine that might work for you. We'll go through that as well. Options for care, modulating factors, things that kind of precipitate or change, exposure to infectious agents, and then spirituality. Okay, so it's just an acronym that I kind of go through. So I apologize, I should have said that right up front, but do you have any beliefs that you're opposed to any kind of antibiotics or anything like that? Would you be open to antibiotics?
I'm okay with antibiotics.
Okay. What do you do for just self-treatment, therapeutic treatment?
I do tend to go a little bit more natural. I try to drink hot tea with honey, things like that. I will do throat drops throughout the day. Obviously, they help relieve my throat and they help maintain my voice a bit. And for decongesting, I try using the sinus rinse.
Ah, the neti pot.
Mm-hmm.
Okay, neti pot. Is that effective?
I do like it, yes.
Does it alleviate that pressure that you talked about in your
It definitely helps. It helps.
All right. Okay. All right. All right. Just so I'm aware, do you have any advance directives in place at this facility or anything like that? Do you have do you have a will or anything like that in place? No living will, anything like that? Would you
Nothing
be
like that.
interested in any literature on that today?
Maybe not today.
Okay, good to go. Okay. We already talked about some of the factors that made it better or worse. It's better. It's better throughout the day as you're moving. Are you able to? Um, are you able to exercise? Do you get lightheaded or dizzy going up or down stairs?
No, nothing like that.
Any issues with breathing?
I haven't noticed any respiratory issues.
Okay.
No.
And in the head to toe assessment, I'll do your breath sounds, and we'll listen to your lungs and your heart, and we'll get a better idea on that level. I just wanted to know if you had any chest pain or anything like that.
Nothing like that.
Okay. All right. Any recent exposure to any infectious or toxic materials at all? Have you traveled recently? Anything like that?
No.
No. Okay. And do you have, if you don't mind me asking, and you don't have to answer it if you don't want to, do you have any spiritual beliefs that we should keep in mind during your treatment here?
No.
Okay. All right. Do if we're talking about your family and the past medical history, are there any illnesses, any factors that any disease processes that have been a factor in your family?
Not really. My dad was diagnosed with some high blood pressure a couple of years ago, and my mother has had a couple of bits of melanoma removed
Okay.
due to, excess sun exposure.
Okay. All right. Any childhood illnesses that you think might have added? Like, did you have any asthma? Do you have any breathing issues?
No.
No. Okay. And no major adult illnesses?
No.
Okay, good to go. All right. At this point in time, we've gone through the history of the present illness. We've established a frame of time where this started to take place, precipitating factors, and I have utilized the client outcomes acronym. We're going to pause at this point in time. We're going to go to a different location so I can have the patient supine and on more of like to simulate a cot or a hospital bed, and we'll do the head to toe assessment with the review of systems. Good afternoon. Resuming our head to toe assessment and comprehensive review of systems. Excuse me. I just wanted the patient to be supine and for me to be able to actually palpate and to perform the head to toe assessment with her in a comfortable position. So, okay. So for general constitutional like review of systems, I'm wondering, have you noticed a drastic increase or decrease in weight that wasn't planned? Like, have you gained or lost more than 10 pounds in the last 2 weeks?
No.
Or since these signs and symptoms started, have you gained or lost any weight?
No.
Okay. Any changes in appetite? Anything like that?
No, not so much.
Okay. So it's not keeping you from eating your regular healthy meals, balanced diet. Okay. All right. Any changes in your skin with this?
Just from wiping my nose a lot, a little irritation around there, but that's it.
Okay. Is it okay if I get some gloves on and do a nice head to toe assessment? Okay. Just to be thorough and make sure that you're doing okay and that we're not going to miss anything.
Yeah.
Do you mind?
Not at all.
Okay. So I'm putting my personal protective equipment on, which includes gloves. I have eyeglasses on. And what I like to do for my head to toe assessment, and I will tell the patient this as well, I use my own acronym, which is DCAP, BTLS, and it stands for deformities, contusions, abrasions, punctures, tenderness, laceration, and swelling. And I will look for any breaks in skin. I will look for, due to the signs and symptoms that she's described, I will compress the sinuses. In the eyes, ears, and nose, I'm looking for, and throat, I'm looking for any kind of exudate or fluid, drainage, dryness or excessive wetness, I should say, runny nose, exudate in the throat. And I will say all these things while I'm going through the head to toe. Is it okay if I put my hands on you, miss? Okay, what I'm going to do is I'm going to start at the top of your head. And what I'm doing is I'm feeling for any deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, or swelling. Okay, and I'd like you to tell me if there's any additional pressure, pain, anything like that. Okay? And I go a little slow. If you feel uncomfortable with any way that I'm touching you, miss, just let me know. I promise that I'm not doing it on purpose, and we'll just reset. Okay? All right, I'm going to put my hands on you. So what I'm doing now is I'm feeling for crepitus, and that DCAP, BTLS, as I said, deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, and swelling. I do not feel or see visually any of the above. Is there any pain or anything like this?
No.
At this area? Okay. Go ahead and lean back a little bit. I'm going to press gently on your forehead, and you let me know if this alleviates that pressure in your forehead. Any change at all?
A little better.
A little better?
Mm-hmm.
Okay. All right. What about here? If I press a little bit?
I can feel the pressure.
Okay. All right. I'm just going to look in your ears real quickly. Okay. And here's where, if I had the equipment, I'd take a peek in her ears to make sure the tympanic membrane is intact. What I will do is I'll take my pen light, and I'm just gonna shine that. Just gonna shine that in the ear. See if I can see any buildup of cerumen or anything like that. Her ears are clear. She clearly takes care of her ears. There's no buildup of wax. There's no tears in the skin. The skin is intact. So I will chart that as well. All right, miss, I'm gonna hold up my hand to one of your eyes, and I'm just gonna flash a light in. And what I'm doing is I'm checking if your pupils are equal, round, and reflective to light. Okay? Ready?
Mm-hmm.
Okay. Okay. Both pupils are equal, round, and reflective to light. There's no blown pupil. There's no dilation or constriction without no unexpected dilation or constriction without the light. Okay. I'm going to take a peek in your nose, okay? Okay, there's no bleeding. There's no excess fluid or drainage coming out of the nose at this time. It's not overly red. It appears to be, skin appears to be intact. If I press on your nose, does it hurt at all?
No.
No? Okay. All right, can you open your mouth for me, please? All right, what I'm doing now is I'm checking for any exudate. Exudate, can you please say ah?
Ah.
And I'm going to lean you forward just a little bit. And again?
Ah.
All right, thank you. All right. At this point, I would probably draw the way that the throat looks if I can. In paper charting, that's what I would do. If they're depending on the system, whether it's CPRS, Cerna, Epic in this area, I would chart that the everything is fine. The throat appears to be within normal limits. I would chart that. I'm going to now palpate the lymph nodes. Is there any tenderness when I push here?
Mm-hmm.
Can you swallow for me? Does that hurt? Or
Mm-hmm.
yes, a little bit. Okay. Skin is intact. Patient does have some tenderness while swelling, and there is a little bit of swelling. So I would chart that as well. Any pain in your shoulders, back of your neck, anything like that? No? Okay. I'm going to listen to your heart and lungs.
Okay.
Okay. I apologize if the bell of this stethoscope is a little bit chilly. Okay.
Okay.
All right. Do you mind if I sit down? Okay. And deep breath. And exhale. Thank you. Just deep breath. And exhale. All right, deep breath. And exhale. Deep breath. Exhale. Gonna have you lean forward slightly, please. And deep breath. Exhale. Deep breath. Exhale. Deep breath. Exhale. One more, please. And exhale. Okay, lean back, relax for a second. Okay, I hear no abnormalities as far as her lung sounds or her breathing are concerned. Heart, no abnormal rhythm, no dysrhythmias. When I was looking into her eyes and her ears and her nose, she did not mention any pain. I did not see any discharge. There was nothing there as far as that's concerned. Did you ever have any issues with nosebleeds? Anything like that?
No.
No. Any broken noses?
No broken noses.
I did not see or feel any deviated septum or anything like that. Just asking. Have you ever had any dental issues with your mouth? Anything like that? No?
No.
Okay. I didn't see any issues with gingivitis, anything with hyperplasia, nothing like that. Okay. Have you ever had, so these sore throats, do they kind of come at the same time every year?
Yeah, seems like kind of when seasons change.
Okay.
Or a lot of rainfall.
Check, I understand. Was there any pain or anything like that when I was listening to your heart, lungs, anything like that?
No.
With the deep breathing, did you feel like you were under stress or duress or anything?
No.
No issues with breathing?
No.
Okay. Have you ever had any issues with syncope at all, or trouble breathing or pain, like pain when you're breathing hard, anything, or on exertion?
Mm-mm.
With taking steps or any kind of exercise? You said that you do exercise pretty frequently.
I
Okay.
exercise regularly.
Okay. No issues with chest pain or anything like that? Okay.
No, nothing like that.
Okay. And any shortness of breath, any history of asthma, shortness of breath upon exertion or otherwise? No?
Mm-hmm.
Okay. All right. Okay. I'm going to continue with the head to toe at this point. I just wanted to pause and get a little bit more focused there for a moment. Do you mind if I listen to your bowel sounds real quickly? No? Okay. And what I'm doing is I'm kind of checking for motility. All right. You don't mind if I sit down again?
Oh, go ahead.
Thank you very much. Can you just breathe normally for me, please? I feel a little pressure here. Okay. Motility sounds good. No abnormal bowel sounds. What I will do now is I'll ask if the patient is comfortable. I'll do a test for rebound tenderness. Basically, just testing if there's any kind of issues in any of the quadrants. Are you comfortable with me pressing on your stomach just a little bit?
Yeah.
What I will do is I'm going to hold my hands like this and I'm going to try kind of like snake down. If it's at all like too much pressure or you feel tenderness or you feel like it's really painful, okay, I want you to let me know.
Okay.
All right?
Will do.
You ready?
Yep.
Any pain?
No.
Any pain?
No.
Anything here?
No.
And here?
No.
No? Okay, and again, like as I'm palpating, I'm also looking for those, that decap BTLS, deformities, contusions, abrasions, punctures, burns, tenderness, laceration, and swelling. I feel that it's important that I reiterate that is what I'm doing for the head to toe the entirety of the time. So I'm going to continue. Can I just see your hands real quickly?
Sure.
I'm going to check. For blood capillary refill here, and make sure. I'm also looking for any signs or symptoms of smoking, clubbing. She does not have a history of smoking or anything like that. I'm going down the arm and just looking for that decap BTLS. Not seeing any broken skin. I would note that she does have a tattoo on her left forearm. Do you mind if I continue?
Go ahead.
Okay. So I'm feeling. And what I might do if it's appropriate and if she's comfortable is I might rock her hips here from side to side to check for stability of her pelvis, and she can tell me if it's hurt at all. It's not indicated, but something I like to do if the patient is comfortable. I'm feeling, is there any instability or pain or anything in your knee?
No.
Can you bend it up for me?
Yep.
And back down. No pain?
No pain.
Okay. I'm going to continue down. Okay, I'm going to feel for pedal pulse. Strong pedal pulse in the right foot. Just feeling any instability, any pain in your knee. No? Can you bend it up for me? And back down. No pain?
No pain.
Okay. Bilateral pedal pulse is present. Can you push down on my hands, please?
Push down.
Yep. Like you're pushing throttle, like the
That.
pedal down. Good. Okay, can you pull up? Toes to ceiling. Very good. Okay. Any pain when you were doing that?
No.
No. Okay. Excellent. All right. Any issues? Did you feel like when I was pressing on your abdomen and your bladder, did you feel like an urgency to have to use the restroom? Did you? No.
No.
Do you have any issues with that at all ever? No.
No.
Okay. And excuse me if this is a little bit private. Your regularity with your bowel movements, is it something that's been in question the last few weeks while you've been dealing with this?
No.
Okay. Okay. Any painful urination or anything like that?
No.
Okay. Any issues with any history or issues with lumps found in your breasts, or any history of breast cancer in your family at all?
No.
No. And we did touch on that, so I apologize if that, if I'm reiterating, but I want to be thorough. Any abnormal pain, swelling, redness, heat, anything like that in any of your body right now?
No.
No. Okay. Do you ever have like a headedness or dizziness, headaches, anything like that? A little bit more with the sinus pressure right now. I think you mentioned that.
Yeah, it's not so much an ache. It's more of like pressure underneath my eyes.
Okay. Have you ever had thoughts of hurting yourself or others?
No.
Okay. So the patient is negative for SI and HI. Have you ever felt like you've heard voices or people that aren't there telling you what to do?
No.
Patient is negative for audio, and visual hallucinations. So we've established that she's not a danger to herself or others. When I was pressing on your lymph nodes, you said that hurt. Did it hurt more or less when you swallowed?
More when I swallowed.
Okay. So we've established that there is pain and swelling in the lymph nodes, and it's one of the things that I would definitely treat in my nursing assessment and diagnosis. It's also something that I would note and appeal to the doctor for additional diagnostic tests to include a rapid strep test, perhaps definitely some blood work. If nothing else, CBC basic chem, looking for any indicators of additional concerns. Let's see. Do you have any history of anemia in your family or
No.
abnormal bleeding?
When I was a child, I had a little bit of anemia, but I've outgrown that. No
Okay.
issue since then.
Any issues with clotting or anything like that?
No.
Okay. All right. At this point, I believe that we have successfully concluded the head-to-toe assessment and the comprehensive review of systems. At this point in time, I would focus on my nursing assessment diagnosis. If she had issues with breathing, this is where I would address that. The fact that it's more of a nuisance, and I did not see any exudate in the throat. I did not see tonsils touching or kissing, I should say. I would basically treat the signs and symptoms. She's got no fever. Because of her father's history with blood pressure, high blood pressure, I'm going to take her blood pressure at this time. I feel like it's indicated by the history, so I will be doing that at this time, manually. Okay. Right arm's okay?
Yeah. Right.
I can do this. I can do it over the,
Okay.
if it's comfortable for you.
Yeah.
All right, this is going to get really tight. I'm sure you've had this done before, but you can just relax. All right, let's turn like that. Just kind of relax. Okay, blood pressure is 111/70. So at this point, I would just ask the patient what her typical blood pressure is. Okay, so your blood pressure is right around 111/70. It's a little bit lower, but it's on the normal spectrum. I'm just asking, is that typically what it is?
Yeah, my mom and I tend to have lower blood pressure.
Okay, and she doesn't take no issues with blood pressure for her, or history of issues with blood pressure other than with your father?
Only with Dad.
With the elevated.
Only with Dad elevated.
Did he ever take any medication for that? Just curious.
He did for about 6 months.
Would you know what the medication is by any
I
chance?
don't.
That's okay.
I'd say.
That's okay. Okay, thank you. I think we've got a good plan of action, a good care plan formulated. I'm going to touch base with my doctors. I think we're probably going to get some blood work for you, but that's something that the doctor has to decide. We'll have a little staffing session about you, at which point we'll call you in, and myself and the doctor will most likely speak to you about how to best proceed. You said you weren't opposed to any antibiotics or anything like that. Would you like anything for that sore throat? Would you just like some lozenges, some Cepacol, anything like that can heal that pain?
Sure.
Okay, would you like anything for that sinus pressure?
Yeah.
Okay.
I would be okay with
I'll
that.
let the doctor know. We'll probably get rolling on some diagnostic tests to include that blood work, and we may do a rapid strep test, just to make sure, just to rule out strep throat.
Sure.
Okay. I don't know if I asked, did you have a history of strep throat at all?
No.
Don't get it frequently.
No.
Okay. I think we have a good plan of action in place. I would appeal to the doctor for different diagnostic tests to elaborate or better indicate what's going on, and then we would treat the patient's signs and symptoms. Thank you very much, and I'll look forward to hearing from you about how I do on this.